Our investigation continues into the Tucson bariatric surgeon hit with a verdict after a patient's death.
Tonight, we're answering the question, who's responsible for overseeing bad care and why the public is often left in the dark? Chief investigative reporter Valerie Cavazos continues her series, Deadly Decisions.
The Arizona Medical Board is the state's watchdog of physicians, the protector of patients. But we discovered transparency is not a main focus. We've reported at least 13 patients died under Dr. Jeffrey Monash's care, all within 6 years, and 5 of those deaths within 6 months. Dr. Monash denies he's done anything wrong in all but 1 death. He resigned in 2020, citing years of surgeon burnout as the reason. Experts have pointed to many red flags, and we examined why the public never knew about them. Attorney Michael McNamara filed a complaint with the Arizona Medical Board 5 years ago.
I think all 13 of these deaths could have been prevented.
He asked for the board to investigate after he discovered a slew of red flags that he charted and presented to the jury in Dr. Monash's trial. What's charted around the 13 patient deaths in red is important. The chart lists serious injuries in orange, medical and behavioral incidents in yellow, hospital peer reviews in blue. There are 7 deaths charted in the span of a year from 2014 to 15. Around this time, court records show Dr. Monash admitted to chronic drug use, severe insomnia, sleeping only a few hours a night, and depression. In 2016, attorney Amy Hernandez filed a wrongful death lawsuit.
As we settled the case, I did report as I was required to do by statute, and in that specific case, Dr. Monash did admit negligence.
This sheriff's document in 2017 shows he threatened suicide. From 2018 to 2020, Dr. Monash admitted he was going through a difficult divorce. A court-ordered clinical psychologist testified Dr. Monash appeared to be manifesting anxiety, paranoia, poor concentration, delusions.
Difficulty with perceptions, it can lead to even psychosis. Trouble making decisions.
McNamara pointed to court records showing Monash had tested positive for marijuana the same day he performed 3 surgeries in 2019. That same year, he admitted to self-medicating with unprescribed Percocet, which is illegal. McNamara documented for the jury several serious incidents involving extreme behavior.
Numerous very bizarre incidents that occurred around this time, involving things like emotional outbursts at work, performing a surgery that was several surgical procedures that had very unusual or bizarre events that did not result in serious patient injury ultimately, but might have. They've had all that information since early 2020, and it's now 2025.
Both McNamara and Hernandez question what exactly the board knows. They say physicians by law have to self-report serious issues like substance abuse and mental impairment. Dr. Barry Weiss is a professor in the U of A College of Medicine who served on the Arizona Medical Board in the 90s.
Yes, physicians are supposed to self-report problems that are on that list of things they have to report.
But Hernandez believes the board should not rely on physicians to self-report.
That goes against what is our human nature, which is our self-interest.
Dr. Weiss says medical staff, physicians, nurses, administrators, by law, have a responsibility to report questionable doctors.
If there's a physician who's repetitively not practicing well and nobody reports it, it's a lot of people's fault for not reporting it.
And they can face disciplinary action. McNamara documented about 24 hospital peer reviews since 2009.
If something's coming to the attention of a hospital peer review committee over and over and over and over and over, yeah, that is a red flag.
Dr. Monash eventually resigned in 2020 after 3 more deaths. The reason, he stated in his resignation letter, surgeon burnout for years, and he needed to step away for the safety of his patients. None of this, including the reason for his resignation, appears on the Arizona Medical Board's website. But what has now appeared, as of last week, the board's letter of reprimand for substandard care relating to Amy Hernandez's 2020 complaint.
You're not going to see settlements, you're not going to see dismissals, you're not going to see anything short of a formal discipline. So do your research, be an advocate for yourself, take someone with you. They're a second set of eyes, they're a second set of ears, you just have to be diligent. And so that's what I say is patients don't stand a chance. You really, there's a lot you don't get to know by law.
And we still don't know what or how much the board knows. Again, we can't get answers to that. Dr. Monash still has his Arizona medical license. He has continually argued he's done nothing wrong. We're staying on this, and you can watch our previous coverage on KOLD.com. Valerie Cavazos, 13 Investigates.